I mentioned that McGraw-Hill had some good labeling exercises that would be good reviews for you. I rubbed my white stuff off my nose. Anyway, so with the male reproductive system, let's see what we can do. Number one, what is this tube? What do you think it is? I think it is the ureter. I think this is the bladder, and this is the ureter coming down from the kidneys. Let's see, number two. What is number two? Number two, I think, is the bulbourethral gland. That's what I think it is. Okay, get a good look. Number three. Now number three, look at where it's going. It's going here. Okay, it's emptying into the ureter. Now what would do that? Well, it might be an ejaculatory duct. I think so. Number four, what is this gland here, or this whatever it is? What do you think it is? Is it the prostate gland? Well, you know, if the prostate gland, as you know, enlarges, if there's cancer or if it just enlarges, and it puts pressure on the urethra, then a man cannot urinate, and he has to be intubated, and there has to be some type of surgery or some type of medicine to reduce the swelling. Some people take saw palmetto berry extract, and it apparently does a pretty good job of reducing the swelling in a large prostate situation. So I'm going to say prostate. Number five. This is going to a little bitty something right underneath the prostate. I suspect that's a seminal vesicle. And number six, oh, that looks like an anus to me, right there. Number seven, oh, what's this going to? Okay, the 7 is going to the vas deferens, and you'll notice that it actually goes through the body cavity in a male and is a point of weakness in the body wall. And so the muscles can split here and cause an inguinal or inguinal hernia, which is much more common in men than in women because of this tube, the vas deferens, going through there. Number 8, what is this? Well, I suspect it must be the testis. No, number 9 is the testis. I'm sorry. Number 9 is the testis. So, number 8 has to be the epididymis, which is where all the sperm is made. And number 10, down here, is of course the epidermal covering of the testes, which is the scrotum. Do you think I got them all right? Well, let's see. Oh, I screwed up. I switched seminal vesicle and bulbourethral gland. That's number 2 and number 5. So number 5, oh, that's that little gland. That's the bulbourethral gland. And, okay, number 2 is the seminal vesicle. That's where semen is produced. So let me change that. Seminal vesicle, and 5 is the bulbourethral gland. And now I have them all correct. So It fooled me. Okay, let's go to the next one. The next one. The female reproductive tract. Well, I'll definitely get this one correct. 1 is, again, the ureter. 2. Now, 2 is called the Fimbriae. Fimbriae. This is the feather-like opening to the fallopian tube, so that, and it brushes the ovary during ovulation and helps to direct the egg into the fallopian tube once the ovary or the corpus luteum has ovulated. At that point, it's not called the corpus luteum until after ovulation, by the way. Number 3, I'm going to say cervix. Number 4, I would say rectum. Number 5, right here, I'll say that's the vagina. And number 6 is the anus. Did I get it right? Yes, I got it right. Okay. One more labeling exercise. And it's sort of important. When you watched the video, what happens during sex, you saw, I hope, the ovulation from Philippi's ovary and the appearance of the egg and her, I say her, entourage of nurse cells. Number 1, what is this? Well, I think it's the fallopian tube. Where's fallopian tube? Oh, okay, that's the oviduct. Oviduct. Number 2, 2, 2, 2, 2, 2, 2, 2. There's the ovary. Number 3, we have the uterus. Number 4, we have the vagina. Number 5, okay, 5 is the primary follicles, and 6 is the secondary follicles, and 7 is the the secondary oocyte, and 8 is the, I'm sorry, 8 is the secondary oocyte. Okay, that's there. It's the developing egg. So what is 7? 7 is the Graafian follicle. It's basically a nearly fully developed follicle that after ovulation, which you see the egg here ovulating at number 9, will turn into the corpus luteum and the secondary oocyte. Oh, there it is. There's the oocyte. That's what I was looking for. Okay, let's see if I got it right. Yep, 9 out of 9. I got it right. Okay, there we are. So inside the ovary, this whole thing's the ovary, we have the development of the follicle. This happens during the menstrual cycle. And right at day 15 or 16, right in the middle of the menstrual cycle, about a 30-day cycle, so maybe day 15, maybe day 16, we have ovulation. Many people report that they can feel the ovulation happen. And this is the basis for the rhythm method of birth control. By keeping a record of your body temperature during the 60s, when birth control drugs and pills came online, but were controversial, the Catholic Church subscribed only to the rhythm method, which was the natural birth control method, or for abstention of sex. And today, We still have people that do that, but most people don't learn about that anymore because they can just go to the drugstore or go to their doctor and get a prescription for the so-called pill. Okay, there we are. So there you have the basic anatomy of male and female reproductive anatomy. And if you have any questions, post them on the discussion board or whatever, and we'll try to address those. Okay, thanks.